Thank you for learning more about our PRIME program, our collective philosophy. The human body is capable of amazing things. Just think of the myriad of activities that are done by everyone on a daily basis. Seemingly simple activities of chewing and swallowing food, balancing upright against gravity in a variety of positions, moving from one position to the other, walking, and even the automatic functions occurring during sleep are in actuality complex and amazing. The way we do these activities over and over creates patterns of movements that are easily repeated without having to think about them. For example, you don't have to think about the complexity of each step when you walk, or each chewing motion when you eat, you just do it. The human body is not the same on both sides. Nearly every system in the body, including the brain, lungs, muscles, and sensory systems, such as your ears and eyes, are not the same on the left side of the body as they are on the right. They have different responsibilities, functions, positions, and demands on them. This designed asymmetry is a good thing and amazing. It gives the brain information to help us decide which leg to stand on, or to step with first, which side of your mouth to chew with first, or which arm to open the door with or hand to write with. This asymmetrical position and function of the body will contribute strongly to those ingrained patterns of how you move. Unfortunately, when some of these patterns become too dominant, the body loses its adaptability to change. For example, when the muscle activity and pattern of standing on the right leg or reaching with the right arm become over-dominant compared to the same activity on the left side, the body will struggle to do the weaker movement pattern and will need to overwork and compensate to perform it when it is needed. This is especially evident when performing activities such as walking or running that can and should use both sides of the body the same. Many negative consequences can eventually occur because of this need to compensate and overwork. This includes decreased muscle efficiency, increased pain, muscle aches and tension, increased susceptibility to injury, poor sleep, autonomic dysfunction, and less than optimal athletic performance, to name a few. Over time, these patterns and our suboptimal adaptations can become so ingrained into our brain as the norm that they're difficult to change. Luckily, due to the common asymmetrical form and function of the human body, these pattern adaptations are predictable and evident to professionals who study these asymmetries and principles, as taught by the Postural Restoration Institute. These patterns are established in the brain based on feedback it receives from multiple areas of the body. The input the brain receives from the body is interpreted and used to make decisions of what to do and how to adapt. Examples of input that your brain uses to make decisions on how to move or hold your posture includes information from your eyes on where you're at in the room compared to other objects and the horizon, information from the sensation of your feet about the floor underneath it, and information from your teeth about the position of your head and neck. For example, think about the feeling of having a very small piece of corn stuck between your teeth that makes your bite feel off, or the feeling of putting on a new pair of glasses after which the floor or stairs don't look quite right, or the feeling of your sock wrinkled inside your shoe. The sensation and input those things are telling your brain is that you need to change or adapt because they don't feel right. These are examples of sensory awareness and information processing that your brain is constantly using to make decisions on how to move and maintain your upright balance and posture. Other examples can include information from the muscles in your neck and jaw, information from your middle and inner ear, the tension felt in muscles and ligaments throughout your body, and how you interpret the space between yourself and other objects around you. Each patient's unique symptoms give us clues as to how the body's adapted to the demands placed on this predictable, asymmetrical system. If you have adapted to poor patterns with faulty input over a long period of time, it may be challenging to undo those habits without changing the input the brain is receiving. By engaging with our team of professionals, we will change the way the brain interprets and processes information from these systems so that the body becomes better balanced or neutral. Then, new activities and patterns of movement will be rewired as normal as these changes are learned with specific activities and exercises. Over time, we anticipate these new normal patterns will become the brain and body's new habits, and the need for other input will not be necessary. This is how we will manage symptoms long term, by looking at the cause rather than just the symptoms themselves. Continue to explore for more information.